Hello everybody, today we're going to talk about mask. Mask is essential in preventing coronavirus. Wear a surgical mask when taking public transport or staying in crowded places. Persons at a high risk of having infection-related complications or weakened immune system, such as pregnant women, persons with chronic illnesses, the elderly, and the very young are advised to wear a mask. Avoid visiting hospitals. If it is necessary to visit a hospital, put on a surgical mask and observe strict personal hygiene and hand hygiene. It is important to wear a mask properly and wash your hands thoroughly before wearing and after removing a mask. Choose the appropriate mask size to fit your face. A 3-layer surgical mask, which includes an outer fluid-repelling layer, a middle layer serves as a barrier to germs, and an inner layer of moisture-absorbing layer provides adequate protection from germs and bacteria. General paper mask, sponge mask, cotton mask, bamboo charcoal mask, and cloth mask do not provide adequate protection. If you wear a niqab, put on the surgical mask underneath. The correct way to wear a mask is always the colored side or side with folds facing downwards, should face outwards with the metallic stripe on the top. Position the elastic bands around both ears. Extend the mask fully, cover mouth, nose, and chin. Mold the metallic stripe over the nose bridge. You can tie the stripe on both sides to adjust the mask if it is loose. The mask should fit snugly over the face. Avoid touching the mask after wearing, as it may be contaminated. Wash your hands immediately after touching the mask. Change the mask timely. In general, a mask should not be worn more than 8 hours and be reused. Steaming or using high heat blow dryer cannot disinfect the disposable mask to be reused. Replace the mask immediately if it is damaged or soiled. If you want to rewear the mask within 8 hours, put the unfolded mask in a paper envelope or wrap it with paper to absorb the moisture. The outside of mask may be covered with germs when it's on the street. Do not pull down the mask to your chin at all times. Wash your hands before taking off the mask. Hold both the earlobes and take off gently from the face. Avoid touching the outside of mask as it may be covered with germs. After taking off the mask, discard it into a little rubbish bin and wash your hands immediately. When having respiratory symptoms, wear a surgical mask even if you're at home. Refrain from work or attending classes at school. Avoid going to crowded places and seek medical advice promptly. If you do not have a clean or certified surgical mask, stay home as much as you can. Washing hands often and good personal hygiene is proved to be effective too. Remember to wear a mask on the street. See you next time!